Our next session is staffing challenges, varying staff levels relative to volume. Our speaker today is Alicia Campbell. She has been in the imaging field for 10 years. She has a bachelor's degree in nuclear medicine and a master's degree in health administration. She has been in a supervisory role for the last 5 years and currently manages the operations of the CT, MRI, nuclear medicine, and PET departments. In 2008, she assisted in the development of a staffing matrix, which has since become a best practice in her health system. Ladies and gentlemen, please welcome Alicia Campbell.
Okay, can everybody hear me? Well, it's lunchtime on day 2, so my goal is to keep everybody awake for the next hour, hopefully. In talking with some of you, I know obviously I have 10 years of healthcare experience, and I thought, wow, I hit the 10-year mark. And then I sat through the last day and a half of lectures and realized I really don't have that much experience. So you might be wondering what on earth I'm doing standing up here instead of sitting back here and learning. I don't feel worthy, I can tell you that much. But my goal with this session is not necessarily to talk to you the whole time, but I think many of us have struggled over the last 18 months or so. And I think we're going to continue to struggle probably for who knows how long. And I think it's important that we share the information and share our experiences and what we've lived through and how we've conquered some of those major challenges that we've faced and how we plan to, kind of proactively conquer the ones we see in the future. So for this discussion, it really will be what you all make of it. I do plan to share with you the experience that I've had, but I would like, all of you at any time feel free to share your experience as well. I do live in outside of Charlotte, North Carolina. I work in Monroe, which is just outside of Charlotte. I live and work in a county that is currently the fastest growing county in the state of North Carolina. Last check, I think we were roughly, 8th in the nation for growth in population. Do all of those people have insurance? Oh no, not even close. But we have been presented some unique challenges just as with everybody else in that, how do you deal with what's going on? I talked with Michelle, my new friend from Cookeville in Tennessee, last night about some of the experience we've shared. And our organization, the one constant in the last 18 months has been change. And probably most of you can say, change is ongoing and continuous. I promise you that if we haven't done it already, we're in the process of doing it, or we're planning to do it in the next year. So we've seen it all. We had a new CEO and a new CFO last year. We are tripling the size of our emergency room, which opens in about 2 weeks. We're going to add 64 slice CT in the next 6 months. We're going to add fixed PET CT in the next 8 months. You name it, it's happening. And all within that, we're trying to deal with the issues of the economy and staffing. And just, from the last talk, they spent 15 minutes talking about productivity. I think it is a hot topic, and I think it's something all of us are dealing with. So though I may not have the years of experience to offer you, I feel as though I've lived 10 years in the last 18 months. So hopefully we'll all kind of learn a little bit from each other as the day goes on. So the objectives today are to gain an understanding of the importance of controlling costs relative to staff salaries. I think everybody can walk out of this room and say, yeah, duh. Gain an understanding of how to monitor staff productivity, learn how to develop and utilize a simple staffing matrix, and gain an understanding of what steps need to be taken to obtain staff buy-in for varying levels. First off, has anybody heard we're in a recession? I think so. There are approximately 50 million people without insurance. That number, I've seen it from 46 million to 55 million, so I don't think anybody really knows how many are without insurance, which presents a unique challenge. I have worked, my 10 years in healthcare has been in a hospital base. So anybody that is in an outpatient center and wants to offer up some knowledge, feel free to do so, but I am from a hospital perspective. We treat everybody. We take everybody. That's pretty much my perspective on it. Those who have insurance are struggling with cutbacks, higher copays, and rising deductibles. we're in a very unique time. Unemployment is on the rise, more so than ever. I've seen varying numbers in our county. I think the last was around 11 to 12% unemployment. When this recession started, we were told at 10% nationwide, it's considered a depression, not a recession. Well, in our areas, there's now some counties that are up to 14%, 15% unemployment. So it's very challenging from our perspective on how do we operate as efficiently as possible so that these people who are struggling with how to pay their bills can get access to health care. There was a study done by the Department of Economic and Research and Policy. I didn't even know there was such a department. They're estimating that the recession could result in an additional 4.2 million uninsured. That's a big number, especially it's going by region based on what your unemployment rate is. And some places in cities are a little bit more successful. Their unemployment rate isn't as high, but going back to where I am, I'm in Charlotte, North Carolina. Does anybody know what one of the biggest employers is in Charlotte, North Carolina? NASCAR. Everybody knows NASCAR and Charlotte. Banks. Bank of America is stationed in North Carolina. Wachovia, who was bought out by Wells Fargo, is stationed in North Carolina. I have neighbors in my cul-de-sac. We have probably 4 people that are employed by Wachovia or Bank of America, and none of them know whether or not they're going to have a job in 6 months. So it is kind of a unique situation and scary for all of us. So for many of our patients in our region, they're beginning to try and decide, do I pay my mortgage or do I get that MRI and pay that $500 deductible? We talked about high deductibles. We've seen a lot of patients come in with certain types of insurance, and they have to pay $2,500 up front. Well, you come in for an MR, that's probably going to take pretty much most of that. And so you've got patients that are having to write a check for $2,000 just to have an MRI done. So we've seen a lot of patients putting off care. Has anybody had that trend as well? I see lots of heads going like this. I have seen a lot of patients that they find something on one study and recommend another study, and they say, I already paid for that study, why do I have to have this one? And they don't have that one. So they're leaving it until it's too late and they have no choice, and now, you're treating them for something way worse than if they would have gotten the care on the front end. So it's a very unique situation. So the hospitals are facing more bad debt, more charity care. That's on the rise, I think, more so than ever. And I know that is true in our region. I assume that it is kind of across the country. From what I've read, it is a nationwide trend that we're absorbing more bad debt because there are people